Let's talk about pain. Multiple types of pain can be distinguished. Damage to the skin, such as a simple cut, can cause a sharp and well-localized type of pain. This is known as somatic pain. It's a type of superficial pain we are most familiar with. Our internal organs also can be a cause of pain. This is known as visceral pain. In this video, we will discuss the features of this visceral pain and discover how it differs from somatic pain. Visceral pain occurs during activation of nociceptors in the thoracic, abdominal and pelvic cavities. It is felt as an aching or cramping sensation which is diffuse and difficult to localize. Often this pain is later felt on the surface of the body, a principle known as referred pain. These features are in contrast to somatic pain, in which the pain will be sharper and easier to localize. The diffuse localization of the pain is thought to be due to the relative low density of nociceptive innervation in the viscera. Also, extensive branching of visceral input in the spinal cord to multiple vertebral levels may contribute to the diffuse localization. Visceral pain will usually undergo two phases. Initially, visceral sensations can present as true visceral pain. This first phase is different because the pain is not referred to the surface of the body. True visceral pain often is described as a dull sensation localized deep in the body. Regardless of the origin of the pain, the perceived location is consistently in the midline, mostly at the lower sternum and upper abdomen. This midline localization is thought to be due to the organs receiving autonomic innervation from both sides through the sympathetic trunks. True visceral pain characteristically is accompanied by autonomic phenomena. These symptoms include nausea, vomiting, profuse sweating, pallor, changes in heart rate, blood pressure and body temperature, and diarrhea. Furthermore, emotional responses such as anxiety and anguish also can be experienced. This is why visceral pain can be such a frightening experience. After this first phase, something strange can happen to the location where the pain is felt. Continuation or worsening of the pain can lead to migration of the pain, a phenomenon known as referred pain. Instead of the common location in the midline of the upper abdomen, pain is perceived at the surface of the body. In the superficial tissues, however, there is no sign of disease. When referred, the pain sensations become sharper and easier to localize. At this point, sensations of referred pain are comparable to pain from a somatic origin and are no longer accompanied by autonomic phenomena. During this following phase, emotional responses are also usually absent. The region in which referred pain is felt depends on the origin of the visceral pain. Different organs and structures have different localizations in which pain can be perceived. For example, an appendicitis can cause pain around the umbilicus, and inflammation of the pancreas can be felt in the back. These odd patterns of referred pain can be explained by the anatomy of the nervous system. In conclusion, visceral pain is caused in the internal organs and is a diffuse, dull sensation felt in the midline of the upper abdomen. Autonomic phenomena can accompany this visceral sensation. If the pain is persistent, it will often be referred to the surface of the body through the phenomenon of referred pain and will resemble somatic pain.